This is ABC News Nightline. Reporting from Washington, Ted Koppel.
Good evening. The disease has already claimed more victims than Legionnaire's disease and toxic shock syndrome combined. More than 800 cases nationwide, 300 plus of those fatal. And every day, 3 more cases are identified. And yet, still, surprisingly few people are familiar with the Acquired Immune Deficiency Syndrome, or the acronym by which it's frequently identified, AIDS. The reason for that may lie...
Okay, now, yeah, can you sit on the couch?
What kind of questions are these going to be? Like, I was thinking of it, you know?
Yeah.
So 13 of us went on a trip to New York City, and our focus was on LGBTQ plus health and the community there in the city. So we connected with the Trevor Project, which focuses on suicide in youth and the LGBTQ community. And we connected with Housing Works that also talked about homelessness and AIDS and helping them get back up on their feet. And we met with Staten Island Pride and also the Anti-Violence Project which focused on domestic violence. My favorite was personally Staten Island Pride. I think it took us kind of out of the city, in a sense, to the forgotten borough. But it took us out of the city into a community that faces a lot of just discrimination in that community because of their conservative ideals, their majority conservative ideals. And I think talking to them and seeing the work that they were doing to kind of cultivate that kind of community and culture in Staten Island was amazing. And they keep working every day to include not only youth and seniors, but everybody in between there. And I think that was really special. That's where we had like a lot of conversation, and I think that was really important because it was our last day, but we were so at the point when we needed to have a conversation and sit down and finally talk about everything. And we started with I think we started with talking about the community and their youth, and we ended up talking about marriage and how that affects the community. We talked about homelessness, we talked about mental illness, we talked about aging out of just the community in general and how you're left behind at some points. We talked about pride and what that means, what that festival means to the community. So I think having those conversations with 2 of the workers was just incredible because we got to see their points of view and see how little things from a kid coming in to a social media post about someone they might know or might not know, how they're working at those little things and how those little things are important, and how we should care about those little things because it's so easy not to. We went to 2 performances that were my favorite parts of our cultural immersion. We went to go see a drag show at Lips, New York City, which was amazing, and having all 13 of us there in that kind of environment really brought us all together. I think it was a very defining moment in the trip.
You're not gonna have everything. We're gonna do it. We're gonna do it.
Oh yeah, I'm like cheeseburger, chicken tenders. Like I've had enough of stuff. Yeah, I've had covered today.
And then we went to go see a Broadway show, Kinky Boots, which was, I had been pushing for it, so it was so amazing to kind of see that and enjoy that with my group. It was so fun and also focused on drag culture and drag representation and just accepting people. And I think those 2 things were so culturally immersive, but also tied into our topics. That was so fun and just a great time to share with 13 new people.
think one of the biggest reasons that it's important to represent the LGBTQ community is because it's a very underrepresented community. Granted, it is a small community, but nonetheless it's important. It's about 3.5% of Americans identify as LGBTQ+, but that number is pretty inaccurate just because there hasn't been any census data, and there won't be any census data in the 2021 if you haven't heard. It's a largely understudied population, largely underrepresented, and largely underfunded. So it just, in all, like, there's a lot of misrepresentation. And I think that it's super important for us, whether or not we're a member of this community, to just kind of go and actively learn about a lot of the disparities between the LGBTQ community and healthcare across the board. Not to make any vague generalizations, but like, sex ed's pretty outdated. They create a lot of fear and stigma around those that are HIV positive or living with a sexually transmitted disease or infection, when I don't think that might necessarily be warranted, right? Like, they don't promote harm reduction models. They kind of promote like you're behaving unsafely, don't do that anymore. You know, like that's not an effective model. At the end of the day, I think it comes down to a lot of stigmatization against the community. When I think about individuals who are struggling to find access to healthcare, or when they actually do have access to healthcare but they're discriminated against once they're in the system, it has to do with just a lot of the statistics I think that are out there that work against them, which are really unfortunate, right? Like, higher premiums come when you're more susceptible to alcoholism, drug abuse, mental health, anything really, right? Like, you're going to be charged more because we have a privatized healthcare system. Because of that, right? Like, these are statistics that the members of the LGBTQ community statistically are more susceptible to. So then once that happens, right, like, that sort of discriminates them against getting healthcare. So that when we think about just the access, but when it comes to once they're into the system, right, it's just more discrimination, right? Like, it's easier for me to relate to people who are of my same ethnic background, of my same socioeconomic status, of my same gender, sexual identity. A lot of it is misrepresentation in healthcare providers. We don't see very many gendered or sexually queer men, women, persons like working in healthcare. Implicit bias is sort of the big thing. And like adverse effects of what kind of seems like pretty neutral questions, whether or not like you're sexually active, whether or not like who might you be engaging in sexual intercourse with, and that can be like a very psychologically like damaging experience for some people. For me, it was really hard when I had to go to like a doctor's appointment and they asked those questions, right? Because that was like an outing experience, you know. It was when I was first sort of exploring and coming to terms with my identity as a member of the LGBTQ community, like to have to tell it to like my healthcare provider when not even my family knew it was scary, because I didn't know how that person was going to react, and you never really know how anyone's going to react. And so it's a dated system, and I think that it's really working against the community. While I was a leader, I don't think I was expecting to learn much, which is so stupid of me. You're always learning, and I think for me, like going into this trip, I think the best thing that I took away was just the idea of that it's important to be proud of sort of the milestones that have been accomplished, right? Like for me to be able to lead this trip so openly and ecstatically as an openly bisexual man would have been unheard of. So like 20 years ago, right? And so just that, like, in thinking about the accomplishments that have been made by predecessors, is super empowering. And it's like, well, shoot, like, I need to do something, you know. I don't imagine it going to any of the scope of individuals like Marsha P. Johnson or any of the startups or founding members of ACT UP, right? Like, that is an unrealistic expectation, but just to know that this is something that I will carry with me for the rest of my life is just sort of a immeasurable blessing.